Thank you to the Rural Maryland Council for inviting me here to speak at your summit. Sorry I couldn't be here in person today, but I'm glad I can still talk to you about what I'm doing in Congress and how we can work together to solve rural communities' biggest challenges. I know what it's like to be in your shoes. As many of you know, I grew up on a struggling chicken and hog farm, cleaned out hog pens, we worked double shifts, and that certainly taught us the value of hard work and perseverance. While we eventually lost the farm and our house, they were all taken, I realized the importance of learning from failure and taking risk to succeed. From running a business to representing you in Congress, those lessons from the farm have always stuck with me. When I decided to run for Congress, one of my key goals was to end the opioid epidemic in this country. For me, it wasn't enough just to be an advocate for folks with mental health and substance use disorders. I wanted to pass policies that would change people's lives for the better. Why? Because the issue is personal. And I'm sure for many of you folks listening right now, it's personal. In 2016, my nephew, Ian Trone, died alone in a hotel room from a fentanyl overdose. Ever since then, I've been trying to keep other families from experiencing that same pain and heartache that we went through. The pandemic has really done a number on all the progress we made in the past years. More and more folks are desperate for help, and they're turning to substances for support. This month, the CDC announced a grim statistic. 100,000 Americans died from overdoses in the last year. That's a new record. It's horrific. And you know well, this epidemic has greatly impacted rural communities. Opioid-related deaths in Allegheny County have more than doubled this year. Across the state, we're seeing opioid use skyrocket. We're working hard in Congress to save lives by passing common sense laws. This year, my bill, the Dump Opioids Act, was signed into law by President Biden. This bipartisan legislation will create opportunities for Americans to safely dispose of their unused opioids, prevent excess use. That's where so many folks start their opioid habit, right in the medicine cabinet of their home or friends' homes. And that's key right there to getting stuff done, working both Democrats, working with Republicans together. And that's why I started the Bipartisan Addiction and Mental Health Task Force. Key word, bipartisan. So we can work together and put away partisan politics and actually create meaningful change. Throughout the course of our task force work, we've helped introduce nearly 70 bills to combat mental health and addiction, including my bill, the Comprehensive Addiction and Recovery Act, CARA 3.0, which aims to tackle the effects of COVID-19 on the addiction epidemic head on. We have a lot of work to do, but we're on the right path. But there's still so much needs to change when it comes to rural health care. Marylanders living in rural communities face so many barriers to receiving high quality care because it's too expensive. Transportation is unreliable. They live simply too far away. And of course, the social stigma, that stigma prevents them from seeking help in the first place. It isn't fair, it isn't right. And that's why we worked hard to get the bipartisan infrastructure bill signed into law. This infrastructure deal is going to make unprecedented investments in our nation's roads, bridges, highways, including a project we fought hard for, Maryland's portion of the Appalachian Development Highway System. We can finish our system. And this makes it easier for buses, cars, and ambulances to reach rural areas. Better transportation means better mental health care. Not only do folks need physical access to treatment, but they also need access to telehealth services. There's still a digital divide in this country that disproportionately affects rural communities and our communities of color. Right now, 11% of Maryland households, they don't have internet access. In Western Maryland, that number is many times higher and unacceptable. Thankfully, the bipartisan infrastructure deal will help connect every single American to reliable internet, with over $65 billion in federal funding for broadband across our country and $100 million right into Maryland itself. That's huge. Broadband deployment will create thousands of good paying jobs, secure education opportunities, a platform for folks to build and run businesses, telemental health, cheaper telehealth. Whether we're talking about accessing high quality healthcare or high speed internet, we're not going to ever stop focusing on rural Marylanders. We're not going to forget where we came from. And thanks again for having me here. I look forward to seeing you again. Hopefully, for sure, it's going to be in person. Thank you and be safe.